Hi, my name is Cameron Strickland, and today we'll be talking about hyper and hypothyroidism. We'll start off with what is hyper and hypothyroidism. Hyperthyroidism is when the thyroid gland produces too much of the thyroid hormone T3 and T4, which can result in an increase in metabolic rate and heart rate, as well as body temperature. For the hypothyroid, is a condition where just the opposite, where the thyroid gland doesn't produce enough of T3 and T4 and can result in a decrease in heart rate and metabolism, which causes an increase in weight gain and fatigue. What is the role of the thyroid hormone? We'll start off with what they are. Thyroxine, the T4, gets converted into T3. Uh, Triiodothyronine, and that's T3, and that regulates basal metabolic rate. So the way this works is that it starts in the hypothalamus with the thyrotropin releasing hormone, which goes to the pituitary gland, which then sends the thyroid stimulating hormone to the thyroid, which then the thyroid will send T3 and T4 out into the body, which will then increase metabolism. When the body has enough of T3 and T4, they will send negative feedback back up to the hypothalamus and will stop the process. For the genetics, hypothyroidism is linked to genes affecting the immune system, which can increase chances of thyroid stimulation. For the hypothyroid, it is linked to genes related to type 1 diabetes as well as celiac disease, and it is caused by iodine intake and stress. For prevalence, hypothyroidism is around 1% of the population, approximately 300 million Americans. More common in women overall, about 5 times more likely in women than men. And Graves' disease is the most common overactive thyroid disease. For hypothyroidism, it affects about 4.7% of the US, approximately 16.4 million Americans, and still more common in women and older adults, older women, and it's more likely with people with celiac disease and diabetes. Hashimoto's disease is the most common underactive thyroid disease. For progression of the condition, if left alone for too long, the overuse of the thyroid in hyperthyroidism will cause the activity of the gland to release excessive amounts of T3 and T4, which will cause a lowered thyroid stimulating hormone. This can progress to bone loss and cardiac issues like tachycardia. For the hypothyroid, just the opposite, where it would decrease T3 and T4, which would elevate TSH and can progress to hypothermia and bradycardic issues in the heart. For common symptoms, hypothyroid symptoms are as followed: weight loss, overheating of the body, tachycardia, sweat goes with the overheating, instability, and body tremors. For hypothyroidism, some of the opposites. You have weight gain. There's overall body temperature decrease. You're just more sensitive to the cold. Bradycardia in the heart, slower heart rate, muscle weakness, as well as dry skin and hair issues such as hair loss. Diagnosis and test options. Okay, so we start off with blood tests. You can test T3, T4, and a thyroid stimulating hormone. I have the safe ranges on the screen from the UCLA Health and the American Thyroid Association. Just to simplify it, if you have a high TSH and a low T3 and T4, you are probably prescribed with hypothyroidism. But if you have a low TSH and a high T3, T4, you probably have hyperthyroidism. For antibody tests, you have a TSI for Graves' disease, That is just a thyroid stimulating immunoglobulin test, and a safe limit for that is point 0.39 international units per liter, and I got that from LabCorp. Uh, you also have imaging options such as thyroid ultrasound and iodine intake tests, since iodine it can cause that your iodine intake is a cause of hypothyroidism. The effect on of hyper and hypothyroidism on exercise response. Working out with hyperthyroidism can cause overheating due to increased body temperature. Your body's already at an overall hotter state, so you can overheat faster. You also have instability due to muscle weakness. You also have already an increased heart rate, so it can increase abnormally through exercise if you're not paying attention. You also have a decrease in respiratory muscle endurance. By this, I mean you have a decrease in maximum inspiratory and expiratory pressure in the lungs. Um, for hypothyroidism, you have a decreased metabolism that can cause a slow recovery time. It's just you're sore longer after a workout. The client has overall decreased power in the body due to muscle stiffness, and you will also see a lower heart rate and cardiac output, which can also lead to a weakened aerobic capacity. For medications and management, for hyperthyroidism, for more severe cases, you can do radioactive iodine therapy, but for more common cases, you would have beta blockers such as propranolol. That just manages heart rate, keeps it where it needs to be, but it also masks heart rate during exercise. So you have to be sure to not rely on heart rate during exercise, more rely on RPE. For hypothyroidism, you have levothyroxine. It is a T4 replacement, fully synthetic, and it returns the body to correct metabolic state, and also helps enhance exercise capabilities so you can work out harder and longer. For my two case studies, I have two case studies because I have two different diseases. We'll start off with hyperthyroidism. I have Jess. She is 40 years old, a female, and a teacher, so a somewhat sedentary job. She has a medical history of heat intolerance. She's hotter. She's hot. She's sensitive to the heat. She has lost 10 pounds in the past 3 months. She has major fatigue as well. She feels tired all the time. She came in with a resting heart rate of 95, so that's definitely tachycardic. My diagnosis would be hyperthyroidism or Graves' disease, and medical clearance is needed with a cardiologist before coming back for exercise. On the hypothyroid side, I have Michaela. She is also 40 years old, a female, and a financial consultant, a primarily sedentary job. I picked both 40 years old and female for both of my case studies just because that is the most common age range and sex for these diseases. Michaela's medical history is that she's recently gained 15 pounds uh, over the past couple months. She has joint stiffness, joint pain, and fatigue, and she came in with a blood pressure of 126 over 80. My diagnosis would be hypothyroidism, and she's cleared for exercise. For exercise testing, I start off with hyper. I chose an aerobic 6-minute walk test, something low intensity. You just have to be careful because of respiratory and cardiac endurance issues. Just a 20-meter straight back and forth walk for 6 minutes, see if we can get a good baseline. Do it indoors as well. Uh, for my resistance test, I chose two. I chose a submaximal 10 rep max test, squats. I just didn't want to do a max test that is too intense. So I chose a hand ergometer test to get some sort of max strength. Um, and for flexibility, I chose a regular sit and reach test. Somebody on hyperthyroidism shouldn't have too much issue for doing that, but they would have an issue with balance. So I made sure to add a balance test for them due to instability and the body tremors. So I chose a Y balance test. For hypothyroidism, my client will be doing an aerobic submaximal cycle test. They don't have as many um, respiratory issues, so I can do something a little more intense just to see their baseline. For resistance, I have the same submaximal 10 rep max squat test along with the hand ergometer. And for flexibility, I will be doing a chaired sit and reach instead of a regular sit and reach due to the muscle stiffness. I just feel like it would be easier for them overall. Next, we have exercise prescription for my hyperthyroid patient. I have an aerobic for my aerobic test. I have 3 days a week. RP at about 11. Remember, we cannot use heart rate as a scale just due to the beta blockers. So we're going to use RP, uh, monitor that during exercise, about 25 minutes. And we're going to keep it indoor on an indoor track just due to, we don't want them overheat outside. So somewhere air controlled would be very nice. For resistance, we have two days a week, 60% of their 10 rep max. uh, 2 sets, 10 reps each, and we're gonna do compound machines just to keep it. Um, I don't need them doing free weights. And for flexibility, we have 3 days a week. Slight tension, 15 minutes per stretch. I think yoga would be a great option for this. It keeps them moving, but is also something low intensity. And for balance, I wanted to add balance in here for the hyperthyroid. We have balance 2 days a week, low difficulty because I don't want to challenge them too much. Don't want any falling, don't want anything like that. But we will be using like a Bosu ball, uh, just basic stability exercises on an unstable surface. For my hypothyroid patient, I will be doing aerobic workouts 4 days a week. They have a little more leeway with their respiratory system. So we have RPE of 12 and it'll be 35 minutes per session. We can do an elliptical, cycling, fast walk, or even a jog, but I'm still going to keep it indoors. Uh, from resistance, we have 3 days a week, as again, 60% of their 10 rep max. I'm just thinking this as like starting off, we're going to keep it low intensity or lower intensity. Uh, 3 sets, 8 reps. It can be a little higher intensity than the hyperthyroid patient just due to overheating and heart rate. And also, we're going to do compound machines. Uh, and then for flexibility, same thing as the other side, 3 days a week to slight tension, 15 seconds per stretch. I think yoga is a great option for both sides. And for balance, we're going to do 2 days a week. It can be a little more challenging since there's not real stability issues with hypothyroidism. We're going to do core stability just because core overall, it overall increases muscular strength and will help with balance. And it also boosts metabolism. Hypothyroid has low metabolism, so I think that would help a lot. For overall modifications, hypothyroidism, I said this before, I say it again, stay indoors in an air-controlled environment to decrease chance of overheating. We don't want anyone passing out, overheating. Uh, Also, you can provide more hydration breaks just to make sure that does not happen. Avoid max resistance exercises just due to heart rate and everything else. And avoid relying on heart rate because the beta blockers could be giving you an inaccurate baseline. For hypothyroidism, we can include longer times for warm up since they are overall colder. They will come in with a lower body temperature to give them more time to warm up before exercise. Also, watch for joint pain and muscle stiffness. That's why I'm keeping it to machines or sitting down. But also monitor that during exercise and monitor the client's medication schedule because we need them to take it before exercise just so we know when it is going. And for conclusion, thyroid hormones affect metabolism severely and can have a serious influence on a person's exercise tolerance. Both types of thyroidisms affect mostly women and require immediate medication management and alterations to their exercise plans according to the medication. Um, but with exercise, It will help regulate their metabolism and suppress the common symptoms. These are my citations, and thank you.